Just a few weeks ago, Minister LaGrange announced our government's work to strengthen the primary care system to ensure every Albertan has access to a family primary care health practitioner when and where they need it. And to achieve this goal, we have to ensure that primary health care is the foundation of the entire healthcare system. We know that there's a lot of work to do, but we're at a critical time for healthcare in Alberta. Many people are struggling to find a family doctor, and those who have them may end up waiting weeks for an appointment. Albertans expect better, and so does our government. This is why I'm pleased that our government is closing the gap in the current funding structure to allow nurse practitioners to open their own clinics, take on patients, and offer services based on their scope of practice, training, and expertise. It's unfortunate that nurse practitioners have been underutilized in Alberta because they can provide an incredible service to Albertans.
Through the new model, Alberta Health will compensate nurse practitioners who want to practice independently, take on patients, and also offer services that reflect the full extent of their training, skills, and experience. The College of Registered Nurses of Alberta will be responsible for the regulation of this work, and similar to other regulated professions, all nurse practitioners must meet minimum requirements to practice and follow standards set by the Regulatory College. As Premier mentioned, we will be providing the Nurse Practitioner Association of Alberta with a grant of $2 million over 3 years. This funding will help implement the compensation model, recruit and encourage nurse practitioners to participate, and provide supports as nurse practitioners plan to set up their clinics and work independently.
There is a large nurse practitioner workforce in Alberta ready and willing to step up. This grant will help NPs open primary care clinics across the province and quickly improve access to primary care for those without a dedicated provider. Nurse practitioners are full-scope healthcare providers who can assess, diagnose, order and interpret diagnostic tests, write prescriptions, and manage both wellness and illness or injury. Until now, accessing a nurse practitioner has been challenging. This announcement ends those challenges.
My hope is that the compensation model we are talking about today will give rural Albertans more access to care in their own communities. I strongly encourage nurse practitioners to consider our rural communities and the opportunities they offer as they look to set up their own independent clinics or join existing primary care teams. I know from the meetings I have taken with municipal leaders since my appointment that the opportunity and the need is there. Today's announcement is yet another tool Alberta's government is using to address healthcare staffing shortages and to strengthen primary health care. It will help ease pressures on the system and means more health professionals will be providing primary health care to Albertans close to home. It's a good day for health care and a good day for healthcare in rural Alberta.